Direct oral anticoagulants for thromboprophylaxis and ambulatory patients with cancers. Definition: patients with cancers are mostly cases the patient with the body cancer is the venous thromboembolism, see in the lungs, pulmonary embolism, or in the venous system. Therapy increases the risk even more.
Venous thromboembolism is a common complication of cancer. While subcutaneous low molecular weight heparin is the standard treatment for cancer-associated venous thromboembolism, the role of direct oral anticoagulants is unclear. A randomized open-label non-inferiority study of 1,046 patients with cancer and confirmed venous thromboembolism tested the efficacy of anticoagulant therapy for up to 12 months. One group was treated with subcutaneous low molecular weight heparin for at least 5 days, followed by 60 milligrams of oral edoxaban once daily. The other group received 200 IU of subcutaneous dalteparin per kilogram once daily for 1 month, followed by 150 IU per kilogram thereafter. The primary outcome, a composite of recurrent venous thromboembolism or major bleeding event during the 12-month follow-up, occurred in 12.8% of the patients receiving edoxaban, as compared with 13.5% of the patients receiving dalteparin. Statistically, this result demonstrated the non-inferiority of edoxaban to dalteparin, but did not demonstrate its superiority. Recurrent venous thromboembolism occurred in 7.9% of the patients receiving edoxaban, as compared with 11.3% of those receiving dalteparin, and major bleeding occurred in 6.9% of the patients receiving edoxaban, as compared with 4.0% of those receiving dalteparin. The authors conclude that in patients with cancer and venous thromboembolism, oral edoxaban was non-inferior to subcutaneous dalteparin for preventing the composite outcome of recurrent venous thromboembolism or major bleeding. Edoxaban's lower rate of recurrent thromboembolism was offset by an increased risk of major bleeding. Full trial results are available at nejm.org.
Application is nursing. A student has been carried or to ask provision of steroids with the aim of building as cost-effective prophylaxis methods not only from the economic point of view, but also in relation on the emerald risk. The profit margin is very variable if we consider of the procoagulants and pro-hemorrhagic element in the evolution of the patient. Pros and cons. Pros: oral anticoagulants based on dicam has several aspects useful when indication in the oncology context. On the one hand, its administration should be about inpatient underground system treatment with routes that are their metabolism social metabolic. Cons: On the other hand, the difficulty in maintaining the international standardized rash with RAT or isocoagulants impacting with activity oncology disease is recurrent. Is unusual. Remember that some in 5 patients with venous thromboembolism disease has cancer and 1 in 10 patients with cancer with T-body and BTA. Conclusion. Primary thromboprophylaxis with SPVNs significantly reduces in the indices of symptomatic BTA in all patients with cancer tried, which embroidered, however, the lack of saturated power in the possibility of established definition conclusion about the effect reliance. The main result which require additional studies to determine the reach.